The need for innovation, digital health solutions, and stronger partnerships to improve healthcare services for serving and retired military personnel, as well as their families, has once again been brought to the fore by stakeholders at a one-day symposium in Abuja, the nation's capital. The event marked the 20th anniversary of the Defense Health Maintenance Limited (DHML), bringing together the Military High Command, healthcare professionals and policy makers to chart a sustainable future for military healthcare in Nigeria.
A soldier's peace of mind on the battlefield is deeply tied to the knowledge that their health and the health of their loved ones back home is secure. Therefore, a robust military health system is not a loss. It is an absolute necessity for operational readiness and national security.
The Nigerian Army recognizes that the effectiveness of any military is largely dependent on the physical and mental well-being of its personnel as combat-ready force. In this regard, the Defense Health Maintenance Limited has remained a strategic partner in ensuring that officers, soldiers, veterans, and their families have access to quality, affordable, and timely healthcare services through its nationwide network of accredited healthcare providers.
As we strive to strengthen our military health systems, there is an increasing need to embrace evidence-based decision-making, leverage emerging technology, and foster strategic partnerships.
Established in 2005, DHML has evolved into a critical institution in Nigeria's defense healthcare architecture, partnering with hundreds of military and civilian healthcare providers across the country to expand access to quality medical services.
DHML is a complementary service to services in healthcare. Okay, so the much they can do, they are doing that. Of course, we have very well, but it will be better.
Speakers at the event highlighted the vital link between quality healthcare, military readiness, and national security, calling for increased funding, wider adoption of digital health solutions, and expanded telemedicine services, particularly for personnel in remote locations.
Just having the knowledge without taking action will not bring a change. In fact, if all we have done today is just to talk without the action that backs up the evidence from what we have said, almost all of us will have just wasted our time.
The DHML continues and has continued to play its statutory role and his mandate, carrying out his mandate. But we must not shy away from the fact that the primary stream of funding for the armed forces is lagging.
The symposium themed Transforming Military Healthcare Systems for Better Health Coverage through Defense Health Maintenance Limited, Progress, Challenges and Strategic Partnerships, featured panel discussions on strengthening healthcare within the armed forces, alongside goodwill messages, cultural performances, and the presentation of souvenirs to distinguished guests.